Jade. My name's Emily. I'm going to be your PA today.
Hi,
How are you?
I'm fine. How are you?
I'm good, thanks for asking. So, can you tell me what brings you in today?
Yeah, I've just had some sinus congestion.
Okay, and then how long has this been going on for?
3 weeks, right around when the seasons are changing.
Okay. So, can you tell me a little bit more about this?
Yeah, so I just feels pain. I also have a runny nose sometimes. In the morning, my eyes are itchy and sometimes they water throughout the day. It mainly happens when I'm outside, and yeah.
Okay, give me 1 second. So, you told me it happened about 3 weeks ago,
Mhm.
and you said in the morning your eyes are itchy. Is it worse in the morning, or would you say it's all day it bothers you?
It's worse in the morning.
Is there anything that makes it better?
Um, I've tried a nasal spray and that helped for a little bit.
It helps in the moment, but
Mhm.
not throughout the day. And then, is there anything that makes it worse?
Just going outside.
Okay. About your sinus congestion, can you tell me, has it gotten worse since it started, stayed the same, gotten better?
It's kind of just stayed the same.
Okay. Have you ever had anything like this before?
I actually had it around this time of year last year.
Okay. And I know you said that you kind of have a headache with your sinus. Would you say it's in the front of your head, the back of your head? If you could take one finger and point to where your head hurts the most.
Right here.
Okay, so kind of on the temporal. And does it radiate into anywhere else?
No, it's just here and here.
Okay. And then lastly, on a scale of 1 to 10, 10 being the worst pain you've ever had, can you tell me where you rate it and also what your 10 would be?
It'd be a 2 or a 3, not too bad. I can still do what I need to do. The worst pain I ever had was a thunderclap headache.
Okay. So based off of what you told me and the reasons you're coming in, I'm just going to ask you a few yes or no questions to give me a better grasp of what I think we're dealing with. So what's your usual weight?
About 100 pounds.
Okay. Have you had any recent weight change?
Nope.
Has your clothing fit more tightly or loosely than before?
No.
Any weakness?
Nope.
Fatigue?
Nope.
And fevers?
No.
Okay. And then talking about your eyes, I know you said that they were watering a little bit.
Mhm.
Has your vision changed at all?
No.
Do you wear glasses?
Nope.
Or contact lenses?
Nope.
Okay. When was the last eye examination you've had?
I only get one when I get a physical. I've never been to the eye doctor.
Okay. Any pain with your eyes?
Mm-mm.
Redness?
Sometimes when they're itchy, I'll rub them so they'll get a little red.
Excessive tearing? I know we said yes to
Yeah.
that. Double or blurred vision?
Mm-mm.
Any spots?
No.
Any specks?
No.
Any flashing lights?
No.
And I don't see any glaucoma or cataracts in your eyes.
Nope.
I know we also talked about your nose and having some sinus pressure and being stuffy. So do you have frequent colds?
No, not really.
And I know you said that you were stuffy. And on top of that, do you have any discharge from your nose?
Just a little runny sometimes.
Is it itchy?
No, not really.
Do you have any hay fever, which is also known as seasonal allergies? Have you ever been diagnosed with them?
I haven't.
Okay. And do you have any nosebleeds?
Nope.
I kind of have an idea of why you're here. I just want to get a couple other things situated. I know you said you tried the nasal sprays, but are you on any other medications?
Nope.
Okay. And then do you have any other allergies?
I've had a dust allergy.
Okay. And what happens with that allergy?
I just get itchy and watery eyes, and I have a little bit of a runny nose.
Okay. And do you take anything for that when it acts up?
No, it usually just goes away.
So now I want to talk a little bit about your past medical history. I know you're a 21-year-old female, but I just want to talk a little bit about your childhood illnesses. Did you have any big illnesses when you were a child?
No.
No. Did you ever have the chicken pox?
Nope.
Okay. And then I just want to talk a little bit about your immunizations, if you know them.
Mhm.
Have you ever had your measles immunization?
Yes.
Okay. Your mumps?
Yes.
Your chickenpox?
Mhm.
Good. Your rheumatic fever?
I think.
Okay. And then have you ever been diagnosed with a psychiatric disorder?
Nope.
Okay. I know you're a newly adult, but let's talk a little bit about your adult illnesses. Have you been diagnosed with any adult illnesses or anything like that since you've turned 18?
Nope.
No thyroid issues?
Nope.
Any heart disease?
Mm-mm.
Okay. Hypertension?
Mm-mm.
Lipidemia?
Mm-mm.
Diabetes?
Nope.
COPD?
Nope.
Do you have any asthma?
Nope. Not that I know of.
Okay. Any hepatitis?
No.
Any kidney disease?
No.
Okay. And then have you been diagnosed with a psychiatric disorder since you've become an adult?
Nope.
Okay. Seem like you're overall a healthy child. Or adult now. Okay. Now we're just going to talk a little bit about your accidents and injuries. Have you ever had an accident or an injury?
Nope. Never broken a bone.
Never broken a bone. Aren't you lucky? Have you ever been admitted to the hospital for any reason?
Nope.
And any emergency room visits in the last 6 months?
No.
Okay. So I know you've said you've never been hospitalized, but sometimes people have outpatient surgeries. Have you ever had any surgeries?
Nope.
Have you ever had your wisdom teeth removed?
Nope.
Okay. All right. Now, I know you said that you had all your childhood immunizations, but sometimes you can only get immunizations when you're adult or you have to re-get them.
Mhm.
So I just want to ask about your adult immunizations. Have you ever had the influenza?
Yeah, I actually just got it.
Oh, this year?
Mhm.
Okay. And then what about a hepatitis B?
I actually just got that too for school.
Oh, did you need titer?
Yep.
Oh, and then you had to redo it?
Yep.
Okay. And then what about your zoster?
I think
It's
I
your
have it.
chickenpox and like your shingles.
I'm assuming I have it.
Okay. And then your pneumococcal.
Yep.
Okay. And then also, I know you're still on the younger side for screenings such as colonoscopies and things like that, but have you gotten a cervical exam done yet?
Nope.
Okay. Okay. And I also know that you already told me that you've never been diagnosed with a psychiatric disorder, but I like to ask all my patients just about their mental health well-being. So I was just wondering, have you felt down or depressed or sad in the last 2 weeks?
Nope.
No. Okay, that's good to hear. And have you lost interest in doing things that you previously enjoyed doing the last 2 weeks?
No.
I'm really glad to hear that your mental health is where it should be and it's all in check. And now I just want to move on and talk about your gynecologic history a little bit. When was your first period?
I think I was 12.
Okay. And what's your normal period like now?
Well, since going on birth control, it's I think like 3 days out of like the 7 days that it's supposed to be.
Okay. And what birth control are you on?
I'm on microgestion.
And do you ever miss periods or is it pretty regular?
It's pretty regular.
Okay. And how would you consider the flow? Would it be heavy, light?
Very light.
Have you ever been pregnant?
No.
Okay. And have you ever had a history of STIs?
No.
And now I just want to know a little bit more about your family history to know if what you're coming in for today is related or, just to get a better picture of your overall health.
Mhm.
Can you tell me a little bit about your dad?
He's I think 46.
Okay.
He's in overall good health. He just has pre-hypertension. But otherwise he's all good.
Okay. And then what about your mom?
She's 43 and she has iron deficiency anemia, but other than that, she's in good health.
Good. And then do you know about your grandparents' health status?
Yes.
Okay, can you tell me about your paternal, so your dad's grandparents?
Yeah, so his mom has diabetes, thyroid, arthritis. I think that's it.
Okay, and then what about his dad?
He has hypertension. He also has arthritis. I think that's it. I don't know.
And do you know how old your dad's mom and dad are?
In their 70s.
Okay. And then what about your mom's parents?
They're actually in perfect health.
Perfect health. How old are they?
They're in their 70s as well.
Okay, and they all good.
Yeah.
Okay. And I forgot. Do you have any siblings?
I actually have a brother.
Oh, okay. And tell me a little bit about your brother.
He is 18, and he also has iron deficiency anemia. But other than that, he's all good.
Oh. Are you and your brother close?
No.
So I know we went over your family history, but sometimes people miss them. So I'm just going to read a couple of common diseases that are hereditary. And if someone in your family has one and me saying it sparks your memory, can you just let me know?
Of course.
Okay. So some common ones are headaches, seizure disorder, stroke,
Nope.
mental illness,
Nope.
suicide,
Nope.
substance abuse,
Nope.
thyroid issues.
I think I said my grandma, my dad's grandma.
Yes, you did. Coronary artery disease.
No.
I know you said hypertension in your dad's grandfather, and your dad has prehypertension.
Mhm.
Hyperlipidemia.
Nope.
Diabetes is in your dad's grandfather also.
Mhm.
Asthma.
Nope.
Nobody. Tuberculosis.
No.
Renal disease.
No.
Arthritis. You did say
Yeah.
both your grandparents. Allergies.
My dad has like seasonal allergies sometimes.
Okay. Is any cancer in your family?
Nope.
And any genetically transmitted diseases?
Nope.
Okay. So your family history overall looks really good. And now I just want to talk a little bit more about you so I can get to know you and what you enjoy and just more about your day-to-day life.
Okay.
So where were you born?
I was born in Elmhurst, Illinois.
Okay. And did you like it there?
Yeah.
What was your childhood like?
It was pretty normal.
Yeah. Did you enjoy it?
Yeah.
Are your parents still together, or
Mhm.
and you and your brother lived together until you came here for school?
Yeah.
Oh, good.
And he's just off to college now.
Oh, where's he going?
University of Illinois.
Oh, so he's staying local.
Yeah.
And I know you said that you're in PA school right now.
Mhm.
So I know you're not done school, but right now, what year are you in PA school?
It's my first year of grad school.
Oh, congratulations.
Thank you.
And occupational history, I know you're a student, but have you ever had any jobs other than that?
I've worked as a CNA and a barista.
Ooh, which one did you like more?
I liked both for different reasons.
And your home situation. I know you talked a little bit about where you live and who you live with when you're in Illinois, but what about when you're here at school?
I live with my roommate, and she's also in the PA program.
Oh, do you guys get along?
Yeah.
Yeah, you guys are friends. No
Yeah.
issues there?
No.
Oh, good. And are you married?
No.
Not yet. And I'm sure, well, actually, I know from experience that PA school can be really difficult, so I'm sure that's a sign of stress. But is there any other thing that stresses you out?
Nope, just PA school.
Yeah, it's not easy. Have you ever had any military service?
Nope.
And what's your financial situation like? Are you okay in school?
Regular college kid that's broke.
Yeah. Are you on loans?
Yep.
So you have it figured out. I know it's not the best, but
Yeah.
you have it figured out. And I know there's not a lot of leisure time in PA school, but what do you like to do for fun?
I go to the gym every morning, actually.
Oh, that's awesome. That's a big part of mental health. you know?
And I like to lay in bed. I like running.
Those all sound like good stress relievers and also a way to keep yourself intact during these tough times.
Yeah.
Do you have any religious or spiritual beliefs?
Not really.
What's your usual daily food intake? Like, what do you eat?
So I wake up and I usually have overnight oats in the morning, and then I have a protein shake after the gym, and then I'll have a banana for snack time, and then I'll have my lunch, lunch, which changes every week, and then I won't eat till dinner, and then sometimes I'll have a snack after dinner.
Okay. Seems like you eat pretty healthy. And what's your usual daily food intake? Or sorry, we just talked about food. Your fluid intake.
I drink about 3 of these.
Okay, and is that water in there
Yes, only water.
and nothing else in your
Just
daily?
like almond milk, but that's
In
with
your
my protein.
opening.
Yeah.
Okay. And then these are just they're not daily, but just things that I would like to know. Do you wear a seatbelt every time you get into the car?
Absolutely.
Good. Do you wear a bicycle helmet?
I don't have a bike.
Okay, so I guess you don't need a helmet if you're not going to be on a bike. Do you wear sunblock when you go outside?
Of course.
Every time you go outside?
No.
When you're
but
at
when
the
I'm at
beach?
the beach.
And do you have smoke detectors in your house?
Yes.
Good. And do you have locked cabinets for medicine and chemicals?
No, but they're higher up.
But you don't have any kids running around in your house anyway, right?
No.
Any pets?
Nope.
Okay. And how often would you say that you drink alcohol?
I would say like only on the weekends, really.
And how many glasses would you say you had when you were out on those weekends?
3.
Okay. And how often do you use tobacco products?
I don't.
No tobacco. And how often do you use drugs that are illegal or not prescribed to you?
I don't.
And lastly, do you have a partner?
I do not.
Okay. If you did have a partner, do you prefer men, woman, transgender, or non-binary?
Men.
And do you feel safe when you're at home?
Mhm.
Okay. Now, these next questions are just what we call review of systems, and it's to just go from head to toe, other than what we've already talked about, just so I can get a general picture of your health. Notice any changes with your skin recently?
No, not really.
Okay, I'm just going to read off a list of things and just let me know if any of them are different.
Okay.
You've had no changes in, no rashes, no lumps, no sores, no itching, dryness, changes in color, changes in hair or nails, or changes in the size or color of any of your moles?
Nope.
Okay. And then can you tell me a little bit about your head? Do you have headaches ever?
No, not really.
So no headaches, no recent head injury, any dizziness,
No.
and no lightheadedness?
No.
Okay. And then we talked about your eyes already. So tell me a little bit about your ears. Do you think you have good hearing or?
Yeah, I haven't really noticed a big difference.
Okay. And do you have any tinnitus, which is like a ringing or a buzzing in your ear?
Mm-mm.
Any vertigo when you're dizzy?
No.
Any earaches?
Nope.
Infection?
Nope.
Discharge?
Nope.
And then for your throat, do you have any conditions of teeth and gums?
Not that I know of.
Do your gums bleed often?
No, not really.
Any dentures?
Nope.
And when was your last dental examination?
I went in June.
Okay. Any sore tongue?
Nope.
Dry mouth?
No.
Do you ever have frequent sore throats?
No, not really.
And any hoarseness?
No.
Okay. And then I'm just going to move down. So we did up your head, and let's move down to your neck. Do you have any swollen glands? Like, have you ever, when you feel sick, you know how sometimes people feel here?
Not really.
Okay. Any goiter, which is when your thyroid, so right in here, is increased?
No.
Any lumps, pain, or stiffness in the neck?
No.
Okay. And do you ever do breast examinations on yourself?
No, I don't know how to, but my gynecologist does them for me.
Okay, well, once I'm done going through all these, I'll definitely teach you how,
Mhm.
just so you can check for yourself since you don't see your gyno that often. But has she ever felt any lumps, pain, or have you ever had any pain
No.
or discomfort in your breasts? Have you ever had any nipple discharge?
Mm-mm.
And do you notice any respiratory issues?
Not really.
So no cough.
Mm-mm.
Do you have any sputum?
No.
Any shortness of breath?
No.
Wheezing?
No.
Pain with a deep breath?
No.
Good. And have you ever had a chest x-ray?
No, I've never had one.
Okay. And then I know we talked with your past medical history a little bit that you don't have any asthma or bronchitis.
Nope.
Okay. Have you ever had any heart issues or heart trouble?
No.
You don't have high blood pressure. Any rheumatic fever?
Nope.
Heart murmurs?
No.
Chest pain or discomfort?
Not really.
Palpitations?
No.
Shortness of breath?
Mm-mm.
Do you ever need to use pillows at night to ease your breathing?
No.
And do you ever have to sit up at night to ease your breathing?
Mm-mm.
Do you have any swelling in the hands, ankles, or feet?
Nope.
Okay. And have you ever had any cardiovascular tests done?
I've actually had an EKG done.
Okay. And what was the reason for that EKG?
Because of cross country, but the results were normal.
Okay. How long ago was that EKG?
6 years.
And tell me a little bit about your gastrointestinal. Do you feel like you eat normally? Does your stomach ever bother you?
Yeah, I meal prep, so like it's pretty basic every week.
Okay. Do you have any trouble swallowing?
No.
Any heartburn?
No.
Any issues with your appetite?
No, not really.
And are you ever nauseous?
No.
How are your bowel movements?
They're normal.
Yeah, what's normal for you?
I go probably like once a day and in the morning, and it's usually not like too loose or too hard.
Okay, and what's the color look like?
It's like a green brown.
Okay, good. Have you had any changes in bowel habits? Sometimes stress can lead that, and I know PA school is stressful. Or has it been pretty regular?
No, they're
still?
pretty normal.
Good. Any pain when you defecate?
No.
Any rectal bleeding?
Mm-mm.
Any hemorrhoids?
No.
Any constipation?
No.
And any diarrhea?
No.
Okay. And then talking about your stomach now a little bit. Do you have any abdominal pain?
No.
And you said no food intolerance?
Mm-mm.
Any?
I'm just vegetarian.
Okay. Is that of choice?
Yeah, and then I'm like semi-lactose intolerant.
Okay.
So, I try avoiding dairy, and if I do eat it, I eat it with lactate.
I was just about to ask that. Okay, good to know. Do you have excessive belching or passing of gas?
Mm-mm.
And I mean, looking at you, you don't look jaundiced to me, but have you noticed any yellowing of your skin?
No.
Any liver or gallbladder issues?
Mm-mm.
And have you ever been diagnosed with hepatitis?
No.
Okay. So this next one is about your peripheral vascular, which talks about veins and arteries, kind of. So do you have any issues with that right off the bat when I just say veins and arteries?
Not that I know of.
Do you have any intermittent leg pain with exertion?
No.
Do you get any leg cramps? I know you like to run, but normally without
No.
running, no leg cramps. Do you have any varicose veins?
Nope.
Have you ever had a past history of clots in your veins?
Mm-mm.
Do you ever have swelling in the calves, legs, or feet?
Nope.
Any color change in your fingertips or toes during cold weather?
Mm.
And do you ever have swelling with redness or tenderness?
No.
And for your urinary system, how would you say that's normal? Does it ever bother you to go to the bathroom?
No, I feel like it's pretty normal.
How often would you say you urinate in a day?
Every time we get a break in class. So, I don't know, like 6, 7,
Okay.
maybe 10. I don't even know.
Do you ever have nocturia?
Yes. It changes a lot, like, depending on the day, I guess. But if I do get up, it'll only be once a night.
Okay. And any polyuria?
Oh, no.
Any urgency when you have to go to the bathroom? Like
No.
feel like you can't hold it? Do you have any burning or pain when you do urinate?
No.
Have you ever had blood in your urine?
No.
Have you ever had any urinary infections?
I had a UTI once.
Okay. When was that?
3 years ago.
Okay. And were you treated with antibiotics for it?
Mhm.
Okay. Do you have any kidney or flank pain? So over in your belly area?
Mm-mm.
Do you have any kidney stones?
No.
Any suprapubic pain?
Mm-mm.
Are you ever incontinent where you accidentally? And then we're gonna move on to your genital area. So we already talked. You had your first period when you were 12. You said, right?
Mhm.
And you said it's pretty regular. It's frequent, comes every month. You don't really miss periods,
Yeah.
right? But it's light,
Mhm.
like 3 days. You said.
Mhm.
Okay. Do you ever have bleeding between periods?
Never.
Do you ever bleed after intercourse?
No.
When was your last menstrual period?
September 2nd.
September 2nd. Okay. Everybody obviously has vaginal discharge, but do you ever think it's too much, or does it ever bother you?
No.
Do you have any itching?
Not really.
Any sores or lumps?
Mm-mm.
You said you've never had a sexually transmitted infection,
Correct.
but you do get tested when you go to the gyno, right?
Mhm.
Okay. And you've never been pregnant. You are on birth control, and your sexual preference is with men.
Mhm.
Do you have any concerns about HIV infection?
No.
Now, for your musculoskeletal, do you ever have muscle or joint pain or stiffness?
Not really.
Do you have any arthritis?
Mm-mm.
Any gout?
Mm-mm.
Do you ever have a backache?
Not really.
Okay. Do you ever have neck or low back pain?
No.
And then have you ever had joint pain?
No.
No, not even when you run.
Just like my ankles when I run, but that's like during my run.
It's when you run
Yeah.
for long periods of time.
Mhm.
For your psychiatric, I know you don't have any mental health diagnoses, but I think it's still really important to get an overall comprehensive idea of the person.
Mhm.
So, would you consider yourself a nervous person?
Not really. Just like before tests.
Yeah, a little bit of test anxiety.
Mhm.
Do you have a lot of tension?
Just the regular amount.
What's your mood typically like?
I feel like I'm just like going through the day.
Yeah. Is that a good or a bad thing though?
A good
for you?
thing.
Okay, good. Do you have any memory changes?
No.
Any suicidal ideation?
Mm-mm.
Have you ever had any past counseling?
Nope.
Okay. And for your neurologic exam, you're in PA school, so you obviously have to be pretty bright. But have you noticed any changes in your mood, attention, or speech?
No, not really.
Good. What about changes in orientation?
No.
How about your memory?
No.
Insight or judgment?
I think it's been the same.
Good. Do you have any headaches?
No.
Dizziness?
Mm-mm.
Vertigo?
Mm-mm.
Have you ever fainted?
No, not recently.
Good. When have you?
Back in like middle school.
Okay. Do you know why you fainted? Were you working out or?
No, it was in music class.
Okay. Did you see a doctor for that?
Yeah.
And they just said,
All good.
okay. Do you have any tremors?
No.
Any weakness?
Mm-mm.
And any paralysis?
Nope.
How about numbness or loss of sensation? So like tingling?
No.
Okay. And I know that you mentioned that your brother and your mom, was it, are anemic?
Mm-hmm.
Do you have any anemia?
No.
Have you noticed any bruising or bleeding?
No.
Have you ever had a past transfusion?
Nope.
Okay. And lastly, for your endocrine, have you ever been told you have thyroid trouble, or have you ever had your thyroid tested?
No.
Okay. Do you ever feel like you have a heat or cold intolerance, so you're always hot or you're always cold?
I'm more hot than cold.
Okay. But not abnormally? You
No.
think it fits the relative average of most people?
Yeah.
Okay. Do you ever feel like you have excessive sweating?
No, just working out.
Which is normal. What about excessive thirst or hunger?
No.
And I already mentioned polyuria to you. Have you noticed a change in glove or shoe size recently?
Nope.
Okay. Well, Jave, I just wanted to say thank you so much for coming in today.
Of course.
And I really appreciate you answering all these questions. And looking at all of your information that you've given me and doing this medical history, I think that you probably have seasonal allergies. So what I'd recommend is maybe we could start you on a dose of Claritin, especially when it gets bad. And how about you come back and see me in a month or two, and that way we can see if this worked or not.
Perfect. Thank you so much.
It was so nice to meet you.
Nice meeting you.